You know, I never grew up wanting to be a drug addict.
I had people say, you're not your typical junkie, like even when I was using.
What does the mother of a heroin addict look like? Well, you're looking at one.
The drugs are there when you're hurting. The drugs are there when you're happy. The drugs are there when you're sad. The drugs are there when you're angry.
I've had addictions for 40 years, so I think if I can do this, and it's not easy.
From going from despair to, you know, joy and happiness, it's a whole different life.
Tell a loved one, reach out to somebody and ask for help, because there's tons of people that care.
You know, hope does exist. There is help available.
You have survived 100% of your worst days. So what are you gonna do with it? Let's start with some good days.
It's been called the indiscriminate killer, an equal opportunity destroyer, the crisis of the century. In 2016, more than 68,000 people died from overdoses in the United States, most of those from opioids. That's more American deaths than during the entire Vietnam War. In Maryland, an average of 6 people will die from an opioid overdose today. It's an epidemic that knows no boundaries, ignoring race, regionality, income, or age. Families are being torn apart, communities ravaged. But there is hope. The state of Maryland is taking bold steps to address this crisis. They are mobilizing resources, coordinating prevention and enforcement efforts, and expanding pathways to treatment. Coming up, you'll witness stories of hope, resilience, healing, and recovery from across the state. We meet ordinary people taking action in their communities. We see how police and fire departments are reaching out in new ways, and see how emergency rooms are offering a clearer path to those in the throes of addiction. We'll see how people in recovery are changing the dialogue and offering hope to others. But first, we meet a resilient mother who's turning her personal anguish into action.
So these are my 4 children. This is Casey, the oldest, Jake, Amber, and Nicholas. This is actually the house that Jake died in. Happy kid. He had a heart of gold. You just never know. This is my angel. This is my son who died of a heroin overdose. I don't want any other family to have to live the new hell that our family lives. So if I can help save lives and help another family from having to live without seeing their child, that's what drives me to keep going. It's just so nobody else has to live this, because I believe recovery is possible. And since that day, I've worked as a family peer support specialist and help other families go through this journey and learn how to deal with your loved one using substances and being a shoulder to cry on, right? Or helping get their loved ones into treatment. And we understand, because we are your peers, and we meet you where you need to be met.
Just checking in, how are things going?
I'm not a clinician.
Good, good, good.
So that's what makes it different, right? I understand, it's lived experience.
I think 6 months would be good for him.
I've lived what she's living, and I'm hoping that she doesn't live what I live now. And that's my goal. I'm hoping to empower them. I'm hoping to let them know that they're not alone, right? And that's the biggest thing. And I'm hoping to let them know that they don't need to be ashamed, right? There's no shame in your child having a disease of addiction. I see success stories all the time. I wouldn't do what I do if I didn't believe recovery was absolutely possible and deserved.
So we're on our way to go and meet one of the families that I work with. Just gonna kind of go and check in with Mom and see how things are going, and see how her daughter's doing, and just this is kind of what we call like a home visit. Our goal is to make sure that, you know, Mom and everybody is in a safe space and feeling good about where they are. We're here.
My daughter, at the age of 18, on her 18th birthday, decided she was going to move out. She moved out because she had already started using.
Stay. Hey there.
Hey, how are you?
Good, good.
First of all, it's life or death. Because of what's out there in the streets now, that's what it is. It's life or death. So Maryland Coalition is where Ginger works. It's been a lifesaver for me a lot of times. A lot of times I felt like nobody understood or I didn't know who to go to, and when you're going through something so huge and traumatic and you can't find support in the people that you know and your friends because you might feel like maybe they're judgmental or they don't understand or they don't get it. It's been very life-saving on many, many days and nights. Just to have that person just be there, you know, hey, I'm having a bad day and I need somebody to talk to.
But I'm always here, right? Yeah. Always just a phone call or a text away. Yep. And that's why it works, right? If I could tell parents anything, I would say never, ever, ever give up hope, right? Because your story doesn't have to end like mine, right? And I wouldn't do the things that I do, right, if I didn't see the success in it. And for Jake, you know, his story ended in a sad way, and our family has been, you know, tragically affected by it, but his death will never be in vain, ever.
Opioid addiction always ends in two ways: early death or treatment and recovery. Just as the disease of addiction affects people differently, so does treatment and recovery look different for every person. Up next, we see how the state of Maryland is offering a wide range of services to meet those suffering from addiction where they are.
And then we're kind of just going to talk about...
Individuals, when they enter in recovery, are in many different places, not only physically, but also mentally and emotionally. We see increases in effectiveness when we have a combination of both peers and clinicians working together to make sure that that individual's whole needs are met.
I was in a car accident a long time ago, and I was prescribed some pills, and I liked how they made me feel once I felt better.
The first step is always taking an assessment of yourself and figuring out if this is what you want. If recovery is 100%, you're on board, you have to want recovery because it's hard work. Then, you know, that's where you would contact us at the health department, come in for an assessment, get an individual counselor, start those therapy sessions, start group sessions, start to take control of your life. Definitely appreciate you being here. Like, our first thing is that there's no judgment here. You know, everything is confidential. You know, I want you to know that you made the first step, and that's coming in. So you should congratulate yourself for that. But recovery is definitely work. The commitment that people need to make is that you're changing your life. Like, you have survived 100% of your worst days. So what are you gonna do with it? Let's start with some good days. You, for so long, have committed to drugs. You know, that was the go-to. Wake up in the morning, drugs. Go to sleep, drugs. You know, middle, drugs. It's time to commit to yourself. Big commitment, a lot of work. But if you're willing to do the work, you'll get the success. What do you do?
And he knows you're struggling?
Mm-hmm. He knows you're struggling.
You gotta cut him off then, because that's not a real friend.
Yeah.
Good.
Dang, that was real.
Yes, because.
I'm just saying.
But it's It works because your attitude on recovery has to become real. We focus on you. We focus on the things like your personality. We focus on the things that you want, your goals, you know, your missions. It's not just about one thing. We handle things one thing at a time, but you have to make sure that it is not emotions, that it's logic. Okay. We focus on your feelings, you know, the one thing that nobody really wants to deal with, your emotions, you know, but it's about finding yourself, and we kind of go through that journey together.
Being patient with people in communication tends to, for me, get to the root of the problem.
It's about being able to relate to other people, you know, not comparing, but relate to other people. You know, you're not the only one who struggles, and that's a good feeling. For so long, people have just depended on the drugs. The drugs are there when you're hurting. The drugs are there when you're happy. The drugs are there when you're sad. The drugs are there when you're angry. So what are the coping skills that we need in order to have a successful life? You know, have peace in your life. Thank you. The best part of my job is being able to see change in people. Like, it is amazing. It is there's nothing else that compares to that. It's priceless.
So some of the different treatments that are available for individuals that are looking to initiate a recovery pathway through treatment would be including medication-supported recovery. And what that is normally combined with is some sort of clinical treatment as well as peer support for the individual. So it's a trifecta of treatment, if you will. You've got the medication support, a clinical support, and then also somebody with lived experience to kind of help you navigate barriers and pathways. Maryland wants to make sure that when somebody initiates recovery or requests help, that someone with lived experience is there waiting to be the warm hand to get them into recovery.
No, it's good though. I mean, I feel really, really good. When I walked into the health department, I saw Sean, and she's a little bit younger than me, so I was a little apprehensive about it. And I've really grown to like call her a friend and a peer and a person in recovery, and like we talk a lot.
I heard you got a new job.
I did.
How's that going?
It's going really well.
It is hard to like reach out when you're scared and you're full of fear. Just have to take a leap of faith sometimes.
I've definitely dived into my program head first. It's got me to where I am today, which, you know, I have a job, I have a bank account, you know what I mean? I have friends, family that are in my life.
Our relationship is like really grown, and watching her grow has been amazing. I went to her first year like celebration. She's just like part of my family now.
The peer recovery support here is amazing. They listened to me when I needed them to. They gave me a lot of hope because they had been in recovery a little longer than me.
I bring to the table that I'm a mom who had a son while using, and just a little bit of my experience and being able to relate to somebody. So I am like where I am now because of it. I'm not ashamed of who I am anymore.
From going from despair to you know, joy and happiness, it's like, it's a whole different life. It's good to see that there's hope out there.
I'm just another person in recovery. There's a lot of us. So I get to like disclose that, and they get to like lean on me, and I get to lean on them, and I get to watch them grow and get their life back. And if they have kids, get their children back, get their family back. I get to see that light come on in their eyes.
One or two of the ideas that we might have is really just looking at some of the pathways he's used and not really been successful at.
Okay.
I think we are at a pivotal moment right now where we're starting to see teams of individuals come together with very diverse backgrounds, clinicians, peers, treatment, and medical staff. And I really think we are at a point now where we're going to start making some progress as a state in helping individuals to connect to recovery quicker and on a more long-term basis.
Opioids have a firm grip on too many in Maryland, but citizens, communities, and officials from across the state are coming together to create positive change that is helping turn the tide on this crisis. On the streets of Baltimore, we meet an unlikely friend who is helping those in need find a path on their own terms.
I've been a cop for 18 years, and I could spot somebody who was under the influence. I was trained as a DRE, a drug recognition expert, in a court of law. Hi, how are you? I met my brother bunches of times, and my cop brain wasn't working. I didn't notice. And I guess with family, you don't. My brother slipped off the wagon after he'd been sober for about 2.5, 3 months, got behind the wheel of a car, and drove over 90 miles an hour high on cocaine, and hit a tree so hard that the car burst into flames. That doesn't get counted as an overdose death. That doesn't get counted in the numbers that the opioid crisis is attributable to. There are so many other deaths and illnesses related to the crisis that is the opioid crisis, that it's far more reaching than we thought. I came back to work about a month and a half later. And when I came back to work, I came back to this job, and one of my commanders said, hey, you're gonna be in charge of a new program called LEAD. It's the universe doing their thing. That is kind of the reason why I have such passion and compassion. Not that I've been there, but because someone else needs to be there for those who are still with us. LEAD is Law Enforcement Assisted Diversion. LEAD is a program that exists that allows officers to take low-level offenses such as drug possession, prostitution, and subsistence dealing, and evaluates that person for their needs and the services that they deserve, rather than taking them to jail. The officer basically unarrests the person and puts them in the care and custody of the social worker. And what the social worker does is give that person the instant support network that they need to help them address the addiction issue that's underlying. So we treat the criminal act as a symptom of a larger disease. We know that we can't cure the disease with arrest. What we have in this area is a lot of people who are living in chaos, who are living in addiction, and who are struggling to get by. So what we'll find is 30, 40, 50-year-old drug dealers. And what they are is they're taking their own prescription and they're selling it out pill by pill, so when they get enough, they can go buy the other thing that they want to feed their larger addictions. We have a different tool outside of arrest, and it is a tool that works incredibly well. The LEAD program not only is law enforcement, it's social workers. There's attorneys, state's attorneys, public defenders, service providers, mental health, substance use. That's the phone number of the sergeant who's in charge of them. At that table, every week, we discuss the needs of every person in the program. And when we're all sitting at that table, we're able to fire across the table. Okay, this person needs that. I can handle that. This person needs this. Can you do that?
Okay. That's what I was saying. Like, we might have to do the warm handoff on the last guy.
Okay. We know that we can't cure the disease with arrest. Every department nationwide, worldwide, has tried to figure this problem with arrest, and it hasn't worked. So we have to do something different, and LEAD is that something different. Hey, how are you? The end goal exists with each and every person, each and every client that comes in, and to be free of the burden that is addiction. My brother's experience. It allows me to look at the people coming into the program with a new lens. So I'm looking for people. Ooh, guess what, guys? Hi, Shelby, what's up? Hey, let's talk for a bit, okay? I'll talk to him real quick. Shelby and I are gonna walk over and grab a sandwich. Let's go get something to eat. When you meet somebody where they are, you are dealing with what is most pressing issue to them. And a person in the throes of addiction may not see their addiction as their biggest problem. They can see their homelessness. They can see their hunger. They can see the fact that they don't look like themselves and they haven't had a haircut or a shower. You meet them at the level where they're ready to change. So when someone comes to me and says, I'm tired and I'm ready, then it is off to the races. So that's the easy one to deal with. That's the easy person to talk to. I've seen people go right to detox from the minute I walked them through the front door of the LEAD office. Thaddeus, I'm Steve, it's nice to meet you. Can I ask you some personal questions? Have you ever been in trouble with the law? Now here's the big question. This is the most sensitive question. Any history of mental health or substance use? Okay. Are you currently addicted? Is that something you want to talk about with somebody?
Actually, I go to ACH.
Well, I mean, you can ask Shelby and Joseph that if you ever need anything, you just reach out to me, all right? All right, Thaddeus, I'll talk to you. All right, guys, see you. I'll see you in about an hour and a half. The people who come into LEAD, they're somebody's son and they're somebody's daughter, just as my brother was somebody's son. And with that attitude, with that mindset, you can't help but do everything possible to do everything that's correct, and to do as much as you possibly can to help out. The hope is in each and every person. If we all start to look at each other like family, then there's no telling how quickly this opioid crisis will be in the history books. As soon as we can get people to feel not alone, we'll be in a great place. Hi guys, how are you? What'd you do to your foot? No matter what you feel right now, no matter how alone you are, we are there for you. And I say we as a community. Everybody wants you to have the living that you want. Everybody wants you to have the sobriety that you want. And there is that support network. You are not alone. No one is.
Chances are you know someone who's affected by this crisis, and you're not alone. 8 out of 10 Marylanders know someone whose life has been changed by opioid addiction. That's why Maryland has declared a state of emergency to help agencies mobilize and get those suffering from addiction and their loved ones the help they need. Coming up, we see how Maryland communities are opening their doors to those suffering from addiction. Local fire stations and hospitals, literal safe stations, are offering assistance for those seeking help.
At 102 Crane Highway North in the lobby, cross street of Baltimore Annapolis Boulevard and Maryland Avenue Northwest for an overdose.
Opiate overdoses aren't something new to us. We've been dealing with this since I've been in the fire service. I said almost 20 years. The frequency of what we're administering now has increased quite a bit. I could probably count on one hand my first 10 years and how many overdoses that I had dealt with. And we're running up to, the most I've ever had here was 9 in one day. And that's a lot. And so far this year, we've had an increase in fatal overdoses.
In Maryland, we had almost 2,000 people die in 1 year. If you average that out, that's almost 6 people a day dying in the state of Maryland. So have you been busy?
Very busy.
So are you seeing an increase first quarter of this year over last year?
Yeah, so mostly actually in the last 6 weeks.
The bad news is that we're seeing an increase in the number of deaths associated with illicit drugs, and specifically an illicit drug called fentanyl. It is a very lethal drug market. This takes an all-hands-on-deck approach. Everybody needs to engage. As an emergency manager, this is the most important crisis I've ever faced, and it's the most important crisis that this country's ever faced. And I don't think we've realized it yet.
You know, we're here 24/7, 365. You know, if you have a problem or you have a family member that has a problem, you know, come to one of the firehouses. And if we can't help you, we'll get someone that can. cooperation with the public health and fire department, police department, crisis management, designed this program, Safe Station, where an addict can come, or an individual can come and seek help for their addiction.
It's a great program in Anne Arundel County so that any given time when somebody says, I've had enough, I need help, they can go to a fire station, they can dial 211 and get help.
Basically, they come to us, we let them in, we go ahead and we talk to them, make sure that they're okay physically and make sure they don't need any medical attention. And if they don't, we go ahead and we sit down with them, we call the crisis response team. They go ahead and they send a counselor up. We wait with them until the counselor gets there, then the counselor puts them in the appropriate program or where they need to go to get help.
It'd be nice to roll it out in other counties more and more.
Yeah. We just need to keep our nose to the grindstone and do the hard work. Find empathy for people that need help and help them.
As we've seen, empathy, compassion, and helping hands are altering people's lives and bringing positive momentum to this fight against opioid addiction. With a wave of resources, communities and individuals across the state of Maryland are changing the course of this epidemic. If you or a loved one needs help, it's out there, it's available. Reach out. The power is in every one of us to be part of ending this opioid crisis today. There is hope.
You know, I never grew up wanting to be a drug addict.
I had people say, you're not your typical junkie, like even when I was using.
What does the mother of a heroin addict look like? Well, you're looking at one.
The drugs are there when you're hurting. The drugs are there when you're happy. The drugs are there